you help menopausal women experiencing sudden hair loss? And can natural remedies like rosemary oil that we've been hearing a lot about actually regrow hair? Or is this more of a social media myth?
So menopause can definitely bring a lot of hormonal shifts, and we'll see that in the way that you present with hair thinning, with body changes, with weight gain. I mean, there's so many things that happen during this turbulent time for a woman. And there are natural remedies that do exist that do have some data, including rosemary oil. So I think that is a wonderful thing to do at home, do it yourself, and it can potentially help with circulation. But really, it's all about a combination approach at the end of the day. There's so many root causes literally for hair thinning. We want to make sure that we are investigating and exploring all of them so that we treat them correctly. So a combination approach is really important. I had a patient who had come in who was in that perimenopausal time. She was losing lots of hair right here in her frontal scalp, which is a really common entity that we're seeing for some reason these days. And she was literally at our doorstep begging us to do hair transplant on her. And she was a case that we had to say, no, you are not a candidate right now. What's more important is that we really determine what the underlying root cause of this is. So we went through a special workup. We did some hair biopsies. We really addressed her medically first and really addressed her hormones, addressed her stress. She was going through an enormous amount of stress, not only with just her life, but then also her hair, which was just impacting all of this. So she had to do her 30%. We had to get her scalp hair back in optimal shape. And doing all of these things together is what really helped to improve her hair volume. So she definitely noticed a difference when we were able to get to that root cause by doing an extensive workup. Had we not said no, and we had done a hair transplant, this poor lady would have lost all of her hair. So it's so important with the timing and seeing an experienced provider, a board certified dermatologist, a plastic surgeon, someone who really knows hair and hair transplantation to really get the right answer, to get the right solution that's needed for you. Now, there are some people that never will need surgery in our hair graft procedures, and there will be patients of ours who we do all the medical workup and everything turns out negative, and turns out they've got more of this genetic hair loss or hair thinning. And in those situations, we talk about other options such as elite graft, which is our next generation in hair transplantation. So everyone is very different. Again, it's customized, but the important thing is that we do a full workup and really get to that root cause.